Hello, and welcome to this webinar on small intestinal bacterial overgrowth. My name's Marianne Williams, and I'm a specialist gastroenterology dietitian. And I'm going to take you through the latest research on the causes, the diagnosis, and treatment of SIBO. I'm very aware that this condition, there is lots of information out there on the internet that's really conflicting, confusing. So, the aim today is to give you all the correct, most up to date researched information so that you can make an appropriate decision. So, what is SIBO? SIBO is small intestinal bacterial overgrowth, and that occurs when there's an abnormal increase in the number of bacteria entering the small intestine. This can lead to lots of gut symptoms and affect the way you absorb nutrients. Now, the whole gut system, from your mouth down through your stomach, the food then drops into the small intestine. And then at the bottom of the small intestine, the food then drops into the large intestine. Now, it's that particular junction between the small intestine and the large intestine that we're talking about. There are bacteria in the large intestine down at the bottom. They should be there, they're really important, but sometimes they migrate slightly up into the small intestine, which is what we're talking about. So, what are the symptoms of SIBO? I'm going to call it SIBO from now on because otherwise it gets very long winded. So, the symptoms are things like bloating, excessive wind, abdominal pain and discomfort, diarrhea, constipation, nausea, and even weight loss. So, let's look into why these symptoms can occur. Well, as I just said, bacteria are absolutely essential. They're essential for our survival, and the majority of the gut bacteria live in that large intestine, the last section of our intestine. The presence of bacteria in the small intestine is normal to a certain extent, and that plays a role in our digestion. But when there are an abnormal increase in that bacteria in the small intestine, that's when we can run into trouble. So, how do the symptoms occur? Well, bacteria in both the small and large intestine will ferment undigested carbohydrates. So, depending on the number and the type of bacteria you've got in that small intestinal area, will depend if you see that gut fermentation, that fermentation of the carbohydrates occurring in the small intestine. And if you do, you're going to see symptoms such as gas, wind, bloating, abdominal pain, nausea, and loose stools. Now, in irritable bowel syndrome, a different condition, you've got SIBO and you've got irritable bowel syndrome, IBS. In IBS, you can get exactly the same symptoms occurring because of gut fermentation, bacterial fermentation of carbohydrates in that large intestine as well. So sometimes it's really difficult to tell whether those symptoms are occurring because you've got IBS affecting the large intestine or you've got SIBO affecting the small intestine. It can be almost impossible to tell the difference. The other thing to bear in mind is that with SIBO, people can get constipation. As we said just now, that can be one of the symptoms. And they think that the presence of excessive bacteria in the small intestine can actually interfere with the normal movement of food and waste through your gastrointestinal tract. And that slowing of the movement of food through there can lead to constipation. This can be particularly relevant for people who also already have problems affecting the movement, so what we call motility issues. So, people with diabetes or certain motility disorders, or perhaps following abdominal surgery, they can all have a problem with food moving smoothly through the intestinal tract anyway. And you put SIBO on top of that, and they've got a double problem. There's also some research suggesting that constipation can occur in SIBO because those bacteria in the small intestine will release methane gas, and that methane gas can actually slow the movement of poo through the intestine, resulting in constipation. Now, I mentioned briefly that one of the symptoms was weight loss, and they feel that looking at all the research, that the excessive growth of these bacteria in the small intestine, where there shouldn't be so many of these bacteria, can actually disrupt your normal digestion processes and therefore disrupt how well you absorb nutrients. Now, in extreme examples, that could lead to deficiencies in vitamins and minerals, particularly the fat soluble vitamins like A, D, E, and K, and vitamin B12. But that only tends to happen in extreme examples of SIBO, and it isn't something that generally will happen with the everyday patient who has SIBO. They also feel that weight loss may occur because some people with SIBO get reduced appetite, so they don't eat as much, and therefore they're not taking in as many calories, and they end up with weight loss. And of course, those with SIBO that have diarrhea, they may lose weight because they're just not absorbing their nutrients properly because the food is rushing through their system too fast. So, what conditions are particularly at risk of developing SIBO? Well, there's a long list here, including things like irritable bowel syndrome, celiac disease, non alcoholic fatty liver disease, pancreatitis, sclerosis, diabetes, thyroid disease, Alzheimer's and Parkinson's disease, functional dyspepsia, inflammatory bowel disease, those that have had previous abdominal surgery, or those that have got structural abnormalities in the bowel. So, there are lots of conditions where you could be at risk of developing SIBO. And we now also see from the research that actually, and I've put two references there, two research papers there for you to look at, that actually taking PPIs or proton pump inhibitors, things like omeprazole, they feel may actually increase your risk of developing SIBO because it reduces the gastric acid production. And if your acid isn't so strong, then that may alter the gut bacteria in the intestine, and that could promote bacterial overgrowth. So, how do you diagnose SIBO? So there is the classic ways of diagnosing SIBO are through breath testing, the lactulose or the glucose hydrogen breath tests. But looking at the new research, are these tests actually reliable? So the latest research on breath testing, and I've put again two references at the bottom of this page, and I've also referenced at the end of the webinar. So there's more references there for you to look at. But with particular reference to breath testing, recent research has shown that only 2% of IBS patients will actually show a positive breath test, suggesting that perhaps SIBO is not actually that common for patients suffering from irritable bowel syndrome. The other thing to consider is that these tests can have quite a high rate of false positives. That's where you've got a condition when you actually haven't. So it's a false positive. And that actually risks you having unnecessary antibiotics for something that perhaps wasn't there in the first place. So the focus now in the research is now to start looking at the types of bacteria that have reached the small intestine rather than just simply looking at the quantity. So rather than just looking at this overgrowth and the numbers, look at the types of bacteria in the small intestine with people with SIBO. And in future, what they're thinking of is to look at the types of bacteria that interact with the body and how they interact with the body. And looking at that and getting more research in those areas may help us to explain the symptoms associated with SIBO, which would be really helpful. So, is there an alternative diagnosis to breath testing? So, we're saying really breath testing, particularly if you've got irritable bowel syndrome, is not particularly accurate or helpful. Now, there is another test, but the truth is that it's not available. So, there's something called jejunal aspirate cultures, but these are the most accurate way, but they're only used in research medical centres. They're not used in the NHS generally because they're very invasive. They require specialist equipment and expertise. They're just not practical. So, what are your treatment options? What are the treatment options for SIBO? Well, antibiotics, rifaximin is the most commonly prescribed and well tolerated antibiotic. And research shows consistently, and I put two research papers there at the bottom, that it is both safe and effective. It, obviously, a lot of people are concerned. I'm taking antibiotics. Surely that's going to have a negative effect on my gut bacteria and might make SIBO worse. But actually, the research shows that rifaximin it does alter the gut bacteria, but evidence suggests that it does so in a manner that's generally beneficial rather than damaging. More research is needed to determine how long the benefits of taking rifaximin last. So, if you take rifaximin and you feel better, how long is that likely to continue for before you might need another dose of rifaximin? And is it advisable to have more than one dose? All of these things need more research. So, if you're not going to take antibiotics, what are your alternatives? Well, we've talked about that. The carbohydrates that aren't digested properly and then get fermented in the gut are part of the problem. So you may or may not have heard of something called the low FODMAP diet, and that may be helpful because it removes the food that the bacteria like to ferment, therefore reducing your symptoms potentially. However, it remains unclear how long or how strictly the diet should be followed for you to see the positive effect in SIBO. And again, we need to bear in mind that the FODMAP diet is only supposed to be done for 6 to 8 weeks, because we know it can have a negative effect on the gut bacteria. So really more research is needed before we can routinely recommend it for the use in SIBO. Probiotics. A lot of people will ask me, what about probiotics? Should I take probiotics? Probiotics have been reported to reduce the severity of symptoms in SIBO, and some studies suggest that using antibiotics alongside probiotics, such as Saccharomyces boulardii, may be helpful. Generally, however, probiotics are seen as a supportive treatment alongside medication. So, pretty much as we've put in point two. So, they're not an alternative to medication generally, not an alternative to the rifaximin, for instance, but they may have a role in preventing the reoccurrence after antibiotic treatment. So, it's really useful to have a look into the research for probiotics. It's not something that I would suggest you do instead of taking the antibiotics. So, also, if you're looking at treatments for SIBO, it's really important that you're actually addressing any underlying conditions that may actually be causing it. So, if you can get on top of these conditions, if you suffer from any of these conditions in this list, and you can get the treatment sorted out properly and get the condition under control, that may reduce your chances of experiencing SIBO. So, in summary, breath tests for SIBO, unfortunately, particularly in IBS patients, do not seem to be highly reliable. Antibiotic treatment with rifaximin does seem to be effective and safe. Diet and probiotics may be helpful, but more research is needed. And more research overall is needed into the gut bacteria so that we can see and find what effective treatments there are out there for SIBO. I've put the list of research papers here, and it's got a little summary of what each paper is looking into in particular. So for those that really want to drill down into SIBO, here are some very useful up-to-date references for you to look at. And thank you very much for listening. If you need any help, please don't hesitate to email me or look at my website, wisediet.co.uk. Thank you. Goodbye.